If diabetes is ignored, it will cause severe damage to the body over a long time. High blood pressure, hearing loss, loss of kidneys, cardiovascular disease, weakness of the immune system, skin infections. One of the most important factors to prevent diabetes is to have a slimming and proper diet and exercise. We can control or treat blood sugar with the foods we eat, so losing weight can prevent type 2 diabetes. Even a 5% reduction in weight has a significant effect on controlling diabetes. Therefore, people with this disease need a diet for diabetes to control it. In this video, we will review the do's and don'ts of a diabetes diet. Does a diabetes diet affect its treatment? People can control or cure type 2 diabetes by losing 15 kilograms. Exactly contrary to the theory that diabetes is permanent. People who have just been diagnosed with type 2 diabetes can get their blood sugar levels back to normal after following a diabetes diet. Also, in a 2016 study, people with type 2 diabetes for more than 10 years could return their blood sugar to normal after losing 15 kilograms. What should be the diabetes diet? People with type 2 diabetes should reduce the amount of meat, adipose tissue, and sugars quickly absorbed. Instead, they should reduce the use of foods overfilled in total sugars, such as whole grains, starches, and dried fruits. In practice, people with diabetes should allocate a significant part of their food to whole grains, vegetables, and fruits. You should replace white sugars with suitable nourishment, fatty meats with poultry and fish, and animal fats with rapeseed or olive oil. People with diabetes should avoid industrial products and cook their own food. Don't believe these words about diabetes. We all hear about diabetic food and non-food from people around us. Some of these words have no scientific basis. Let's check together a series of rumors about diabetes. Number 1. Diabetic people are not allowed to eat any kind of sweets. There is nothing wrong with eating a little sweet for diabetics if they follow a balanced diet. Nevertheless, it is better for people with diabetes to reduce the use of sugar and sweets. If sugary foods are consumed excessively, it will not be easy to control blood sugar and weight. Number 2. Diabetic people want to eat fruit as much as they want. The fruit is good, but too much can disrupt diabetes control. Along with vitamins and minerals, fruit also has sugar. Fruit sugar can raise blood glucose. Fresh fruit is superior to fruit juice. Fresh fruit has fiber and slows down the process of glucose increase. Enjoy fresh fruits, but pay attention to their amount. Number 3. Salt is not essential. Salt does not affect blood sugar levels, but is related to blood pressure. Blood pressure and salt sensitivity are prevalent in people with type 2 diabetes. People with type 1 diabetes are at risk of high blood pressure, and their kidneys are also affected. High blood pressure is one of the main reasons for increasing the risk of heart disease and stroke. Diabetics are advised to limit their salt intake to less than 1,500 milligrams daily. Number 4. Leave the fat aside. Because fat in the digestive system slows down the emptying of the stomach, some fat can prevent blood glucose from rising after a meal and help control blood sugar. Because people with diabetes are more at risk of heart disease, eating some healthy fat can benefit health. Number 5. Many foods are forbidden. Even if you have diabetes, no food is prohibited, even pizza, as long as you pay attention to the amount of protein, carbohydrates, fat, and salt. If you have diabetes, eat lean proteins, whole grains, low-fat dairy products, and fresh fruits and vegetables. Eat less high-fat foods and foods that contain sugar. Number 6. Low carbohydrates are the key. Diets that are low in carbohydrates can help control diabetes, but this method may not work for everyone. Some low-carb diets have high amounts of fat, which is unsuitable for people with type 2 diabetes because these people are at risk of heart diseases. Look for a low-carb diet that balances protein and healthy fats. Carbohydrate control is vital in the diet, but maybe a low-carb diet is not relevant for you. Do you know what the worst eating habits for diabetics are? The first one, not eating breakfast. You have often heard that breakfast is the day's most important meal. This is especially true for people with diabetes. Delaying breakfast can cause hypoglycemia or a severe drop in blood glucose. Even if the person does not eat breakfast most of the time, he should include at least one small snack in his morning routine. This snack can be strained yogurt or a boiled egg with bran bread. You definitely don't have to sit and eat your meal. You can prepare something light for yourself that you can eat while moving. Number 2, a diet that is overfilled in bad fats. Researchers have stated that excess consumption of fat, more than 30% of daily caloric intake, may worsen insulin resistance. Avoid meals high in saturated fats, such as those in fast foods. Also, Some research has shown that unsaturated fats can positively affect insulin resistance. These types of lubricants also reduce liver fat. Unsaturated fats can be found in foods such as olive oil, nuts, and seeds. A diet rich in unsaturated fats and low in saturated fat improves cardiovascular health, reduces LDL or bad cholesterol, and lowers triglycerides and blood pressure. Number 3. Overconsumption of meat. Consuming too much meat and protein affects your blood glucose level, especially if the protein of that meal comes from red meat. Red meat hurts insulin sensitivity. Research has shown that increasing the consumption of red meat is related to increasing the risk of infecting to type 2 diabetes. To reduce the risk of cardiovascular diseases, you can count on reducing the use of red meat. Number 4. Your meals are not balanced. Overeating one thing, like carbohydrates, and too little of something else, like vegetables and lean proteins, can increase blood sugar. A balanced meal can fill you up and give your body the necessary nutrients. Combine a lean protein, such as boneless, skinless chicken breast, with carbohydrate food like brown rice. This slows down digestion and makes you feel fuller for longer. Also, your blood sugar will not rise too high after the meal. Number 5. You forget to eat. Yes, you may not wholly forget, but you might get too busy and suddenly realize that it's been a few hours since your previous meal. By doing this, you are putting yourself in danger. Too much spacing between meals can also cause hypoglycemia in people with diabetes, especially if they take particular medications for their diabetes. If hypoglycemia is left untreated, it can worsen and cause dizziness, lethargy, and even fainting. Severe hypoglycemia can lead to seizures, coma, and even death. Paying attention to meal times can also help with other good habits, such as regular blood sugar monitoring. If you have diabetes or prediabetes, it is better to keep chocolate, sweets, fruit juice, or milk near you so that you can raise it quickly if your blood sugar drops. Number 6. Your snack is made with white flour. The glycemic index of foods and the quality of carbohydrates in your diet are essential. Research has shown that refined carbohydrates, such as white bread and chips, can increase the rate of insulin resistance. Limit processed products made with white flour and extra sugars. Instead, focus on healthy snacks high in fiber and whole grains, such as some cheese with ban bread or popcorn. Number 7. You don't know what to eat before exercise. Checking blood sugar before exercise is crucial for diabetics because exercise lowers blood sugar. This information helps us to know before exercise, do we need a snack to keep our blood sugar from falling or not. One of the recommendations is that diabetic patients take glucose tablets with them when they go to practice, so that they can quickly solve it if the glucose drops too much. Glucose gels or even sports drinks can also help treat hypoglycemia during exercise. If you experience hypoglycemia with regular physical activity, consult your doctor. You may need to re-look at the medications you are taking. Number 8. You overeat. In patients with type 2 diabetes, weight gain due to overeating can increase insulin resistance and even the need for medication. Eating large meals, especially those high in carbohydrates, can cause blood sugar to rise significantly after a meal. Usually, the blood sugar of people with diabetes should be less than 180 milligrams after meals. To see how food affects your blood glucose, check your blood sugar before and 2 hours after a meal. If the blood glucose before the meal was 120 and after 250, this 130 number difference indicates that the meal had very high carbohydrates. Number 9. Dinner or snack is very close to sleeping time. Eating late can affect fasting blood glucose levels the next day. Late night meals usually cause blood sugar levels to be higher than usual the following day. This amount is troublesome if the standard fasting blood sugar limit is higher. People with diabetes should eat more meals and snacks at night that are rich in fiber, carbohydrates, and lean protein. Before eating, ask yourself if you are eating because you are hungry or used to eating late at night. If it's just a habit, instead of eating, make yourself herbal tea and enjoy it. Now you know that a diabetes diet does not mean eliminating all carbohydrates and sugary substances. The purpose of a diet for people with diabetes is to create a balanced relationship between different nutrients. A diabetes diet helps you to control your blood sugar and even cure this disease almost. Enjoy this video, hit the like button and subscribe to our channel for more videos like this. Thanks for watching.